Assalamu alaikum everyone. Today we are going to study spleen. Spleen is an important vista and responsible for providing phagocytosis, immunity and red blood cells formation. Red blood cells are produced in the spleen and they complete their span in the spleen as well. It is a wedge-shaped organ. So here I form a wedge-shaped organ which is lying mainly in the left hypochondrium. It is lying in the relation with stomach and it is lying along the 9th, 10th and 11th ribs. It's an important MCQ where they ask that around which ribs it's lying. So it's 9, 10 and 11. It's lying like this obliquely and it's lying in the left hypochondrium but it's pointing towards the right iliac fossa. So it is like that. Spleen is highly vascular and it is dark purple in color. Dark purple color इसीलिए क्योंकि ये highly vascular है और यहाँ पे RBCs की formation हो रही होती है. If we talk about the gross anatomy of spleen, it has 2 ends and 3 borders, one anterior and posterior and then superior border, inferior border and then the intermediate border. If we talk about anterior end is expanded and it's downwards and forwards. If you see here in spleen, this is spleen. So tail of pancreas is going into the spleen. This is the right side and this is the left side and it is lying in the left hypochondrium. If you see here, this is the expanded round end that is known as the anterior end. अगर हम मॉडल को ऐसे करें तो हमारे पास this is the rounded one is the posterior end. Posterior end is rounded while anterior end is expanded and downwards and forwards. And superior border is this one. On the anterior surface it's lying and it is the anterior border, while this is the intermediate border. So we have the superior border and intermediate border. After that, if we see, this is the inferior border. So inferior border is lying on the back side, while on front side you can see 2 borders. One is the superior border and one is the inferior border. After that, we have 2 surfaces on the spleen. One is the diaphragmatic surface and one is the visceral surface. Diaphragmatic surface, as the name shows, spleen is lying in contact with the diaphragm, and the surface which is giving contact to the diaphragm, the surface of the spleen which is giving contact to the diaphragm will be known as the diaphragmatic surface. Diaphragmatic surface is convex and smooth, while visceral surface कौन सी होगी जहाँ पे different viscera आके लग रहे होंगे. तो all the surfaces of spleen where it contains the impressions of different viscera, that is known as visceral surface. So spleen is in contact with the stomach, kidneys and colon and pancreas. So there will be 4 impressions on the visceral surface, while diaphragmatic is giving contact to the diaphragm surface. So if we see here, the lying between the superior and inferior border, this surface is known as the diaphragmatic surface. So diaphragm is in contact with this surface, while between the superior and intermediate border, the surface lying is known as the surface for gastric impression. So stomach is in contact with this surface lying between the intermediate and superior border. While if we talk about the renal border, then this is known as the renal. This is lying between again intermediate and inferior border. This surface is known as for the renal impression. And then the colonic and pancreatic impression. As you see, tail of pancreas is going into hilum of spleen. So this surface is known as the pancreatic impression surface, while this anterior end gives the attachment to the colon. So this is known as the colon impression, where this 3 is written. This is colonic impression. So colic impression, pancreatic impression, then gastric impression, and then this is the renal impression. While this between the superior and inferior border, this is the diaphragmatic surface. Diaphragmatic surface is convex and smooth. Now, very important, often asked in Viva, what is the blood supply of spleen, and tell us about the open and closed theories. So, you all know that celiac trunk gives 3 main branches: left gastric branch and splenic artery branch. So splenic artery is arising from the celiac trunk. So it is the main branch and it is the largest branch of the celiac trunk. So the celiac trunk giving 3 branches: left gastric to the stomach, common hepatic to the liver, and splenic to the spleen, and it is the largest branch. Splenic artery has a tortuous course. It passes through the lienorenal ligament and reaches to the hilum of the spleen. I will show you in the model. You can see here. So from the celiac trunk, splenic artery is arising. This is the celiac trunk. Celiac trunk is given the common hepatic, which is dividing into right and left hepatic arteries, and then this is the splenic artery, which is coming from the celiac trunk. So, and this is the left gastric. So this splenic artery, you can see it's not straight like celiac trunk. It is tortuous in course. So we say that it arising from the celiac trunk and it is tortuous in course, and then it between this spleen and pancreas, you can see here, this is the hilum of spleen. This is known as the hilum of spleen. Hilum of spleen giving attachment to the vessels. You can see here the vessel is entering to the hilum of spleen through this lienorenal ligament. This is the lienorenal ligament which is connecting the spleen and the kidneys. So splenic artery will enter into the, this is the hilum, it will enter into the hilum of spleen through the lienorenal ligament. Now after entering splenic artery, when enters into the hilum of spleen, you can see it further divides into further branches. It divides maximum into the 5 to 6 branches. After dividing into 5 to 6 branches, splenic artery, now this 5 to 6 branches will further repeat their divisions, and then they will divide into penicilli, ellipsoids and arterial capillaries. So we have the penicilli, ellipsoids and capillaries. These further divisions are known as these penicilli, ellipsoids and capillaries. Now these penicilli, ellipsoids and capillaries will follow either the open theory or either will follow the closed theory. According to the closed theory, these capillaries, end में सब capillaries बनी है, तो ये capillaries should continue with the venous sinusoids in the red pulp. As it is highly vascular, spleen के अंदर white और red pulp होता है. जो red pulp होता है वो RBCs की formation में help कर रहा होता है. तो वो कहते हैं कि वो क्लोज थ्योरी में ये होता है कि कैपिलरी आगे साइनोसॉइड्स के साथ कंटिन्यू कर जाती हैं जो रेड पल्प में प्रेजेंट होते हैं. तो कैपिलरीज उनके मुताबिक कहने का ये है कि साइनोसॉइड्स में ड्रेन हो जाती हैं इन द रेड पल्प, और जो फर्दर जो है फिर जब वो साइनोसॉइड्स में ब्लड ड्रेन होता है तो फिर दे विल फॉर्म द वेन्स. जबकि ओपन थ्योरी कहती है कि जो कैपिलरीज हैं वो डायरेक्ट इनटू द रेड पल्प ओपन होती हैं, किसी वीनस साइनोसॉइड्स के अंदर ओपन नहीं होती, और फिर ब्लड वहाँ रेड पल्प से एंटर होता है इनटू द वीनस साइनोसॉइड्स. यानी कि ओपन में वो कह रहे हैं कि साइनोसॉइड्स बाद में आते हैं, बाईपास हो जाते हैं और कैपिलरीज ड्रेन हो जाती हैं डायरेक्ट इनटू द रेड पल्प, फिर आती हैं वीनस साइनोसॉइड्स में. जबकि क्लोज में दे आर सेइंग कि कैपिलरीज फर्स्ट ड्रेन इनटू वीनस साइनोसॉइड्स इन द रेड पल्प एंड दे फॉर्म द वेन्स. While there is an other theory which is known as compromise theory, जिसमें वो कहते हैं कि open theory is present in the distended spleen and contracted spleen के अंदर closed theory होती है. So these are the theories you should know. After that, if we talk about the venous drainage of the spleen, venous drainage of the spleen comes from the splenic vein. Here we have this splenic vein. Splenic vein takes a drainage from the spleen, and then inferior mesenteric vein also drains into the splenic vein, and then splenic vein goes and it unites with the superior mesenteric vein, and then venous drainage collectively both veins went into the portal vein. So ultimately it is draining into the portal vein. While spleen has no specific lymphatics, spleen lymphatics is draining into the pancreatico-splenic lymph nodes. So if you can see here in the spleen anatomy, what you're going to see that there is this white pulp and then there is the red pulp. अब उन red pulp के अंदर these smaller are the sinusoids. So open theory says कि जो capillaries से blood आएगा, यहाँ से जब blood आएगा वो blood जो है वो डायरेक्ट जो है रेड पल्प में आ जाएगा, रेड पल्प में आ जाएगा, और फिर रेड पल्प जो है वो इन साइनोसाइड्स के अंदर फर्दर उस ब्लड को भेजेगी. जबकि क्लोज थ्योरी कहती है कि जब कैपिलरी से अंदर ब्लड आया तो फर्स्ट इट विल गो इनटू द साइनोसॉइड्स एंड देन साइनोसॉइड्स विल गिव द ब्लड इनटू द रेड पल्प एंड देन दे विल फॉर्म द वेन. So this is the difference between these two theories. If you want to see the relation of spleen with the stomach, you can see this is stomach and spleen is lying here in this region. And one other question is frequently asked for the spleen, that when there is splenomegaly, when in any disease there is enlargement of the spleen, why it reaches up to the right iliac fossa, इसकी ग्रोथ इस तरह से क्यों होती है, इसकी ग्रोथ ऐसे क्यों नहीं होती है. तो इसकी ग्रोथ यहाँ से यहाँ इसलिए होती है कि ये इस तरह से मैंने बताया कि इस तरह से ऑब्लिकली लाई कर रही है 9, 10 और 11 रिब्स के, और पीछे किडनी के साथ हैंग है विद द लिनोरिनल लिगामेंट. तो वो जो लिनोरिनल लिगामेंट है वो यहाँ पे लाई कर रहा है. और किडनीज इसको इस तरह ऑब्लिकली हैंग कर रही हैं, तो उसकी वजह से जो इसकी डायरेक्शन है उस हैंगिंग की वजह से वो इस तरह से होती है, बजाय इसके कि वो सीधी इस तरह से हो। दैट्स इट फॉर द स्प्लीन। थैंक यू सो मच।